So we are live. Yes, Garima, you can continue.
So, good afternoon, everyone. Today, our first participant is Deepa Chauhan to connect to us. Good afternoon, ma'am. Samita, ma'am, good afternoon. And Ruby, ma'am, good afternoon to you also. And good afternoon to all the participants. And I welcome all the participants in our webinar today, organized by PsyCoolG Connect, an initiative by PsyCoolG Wellness Private Limited. This is our 56th webinar, and I welcome all the participants for sparing your valuable time from your Sunday. Sunday is a weekend and everyone wants to spend it by resting, but still participants investing their time in gaining knowledge. Thank you so much for that, and I appreciate you all for this. And to our resource person as well, that our resource person is giving webinar on the rest day also. Yeah, thank you, ma'am. And our resource person for today is Dr. Nidhi. She is an occupational therapist and a gold medalist in BOT, and she is the recipient of Best Paper and Best Project Award in the fourth conference organized by CDMRP Kerala. And she is certified in PFA as well. That is our today topic. Our topic for the day is psychological first aid. What is psychological first aid, and what is the role of it? We are going to cover all these things today. And with it, I would like to tell something to you guys also. The link for the certification and the feedback link, all these things are in the description box as usual. So if you are interested in the certification, then you can opt for that. Otherwise, please fill the feedback link. That link helps us to improve ourselves. Please do that. And with it, I would like to hand over the mic to ma'am. Ma'am, please, it's over to you.
Thank you very much, Garima ma'am. Good afternoon, and congratulations to all of you for taking the initiative to update your knowledge on a topic, psychological first aid, which is actually relevant at this moment, considering the pandemic crisis that the entire world is facing right now. So, I have decided that I will be talking about psychological first aid with special emphasis on the COVID 19 crisis so that we can apply what we've learned in our present life situation and benefit from today's learning experience. So, I'm going to start sharing my screen now. I take this opportunity to also thank PsyCoolG Connect and the entire team at PsyCoolG for making this possible for all of us to attend lots of informative webinars without paying any charge and in the comfort of our own homes, where we are able to gain a lot of new knowledge and apply that as a part of our personal and professional lives. So we will begin with psychological first aid. Firstly, deconstructing the words. What is first aid? So, first aid is the emergency response or the emergency care which is given immediately to an injured person. This is the a definition of first aid which we all have known since maybe 10 years of age or maybe less than that also. Now, what is the purpose of first aid? The immediate purpose of first aid is to minimize injury and in turn prevent or reduce future disability. In serious cases, first aid may be necessary as a life saving measure also. So, what is this mental first aid and psychological first aid? And how are both of them different? Mental health first aid or emotional first aid is the help that we give to somebody who is developing a mental health problem or somebody who has an existing mental health problem which is worsening, or there is an exacerbation, or there is some experience in the worsening of the mental health problem leading to acute mental health crisis. Now, what is different about psychological first aid and how does it differ from mental first aid? Psychological first aid is usually given as a response to a disaster or an unexpected or unanticipated situation, as a response intervention whose primary goal is to promote safety, stabilize the survivors of the disasters, and connect the individuals for seeking appropriate help and resources as may be the necessity. So, how is it related to first aid? We saw that first aid is the emergency care given immediately to the injured person before professional help, that is, before a doctor or a qualified medical professional can evaluate and provide further treatment. We administer first aid. Anybody who has the basic training in first aid can administer basic first aid. Similarly, psychological first aid is not the solution or is not the only response or the only intervention which is given to a victim of a disaster. Rather, it is the first step or it is the primary intervention which seeks to build upon, or which is the foundation on which further help or further resources can be provided and the individual can be guided in the right direction so that they seek qualified professional help if that is the necessity. So, coming to psychological first aid, what are the key elements of psychological first aid? Because psychological first aid is provided when disaster strikes or when there is a natural calamity or when an individual is facing an unexpected situation or an unanticipated situation, the first aim or the first motive of psychological first aid should be looking after the basic needs. Just as Maslow states in his theory of the various levels or the various needs, we progress from one level to the other. So, firstly, we need to address our basic needs. In the hierarchy, our basic physical needs to be addressed, like housing, food, shelter, clothing, etc. The second key component is listening. Listening is the cornerstone of psychological first aid. Only if an individual is an effective listener and an active listener at that, then he will be effective in his psychological first aid, and the psychological first aid that he is providing will be able to show good results or positive results. Another element is comforting. See, it is a basic human tendency to seek comfort whenever we are in a difficult situation. So, a psychological first aider should have the relevant skills of being able to comfort the recipient of his services. The important other factor is connecting. Only when we are able to connect with those in need of our services and connect so that we establish a working rapport with them, we will be able to work better because they will then be able to open up to us and actually listen to us, and in turn we listen to them. The next element is protecting, wherein we need to protect or prevent further damage or further harm from happening to the individual who has already undergone so many distress or such a difficult situation. Lastly, it is about instilling hope. It is similar to the comforting principle where we strive or we work on an intrinsic hope. So, when a difficult situation strikes or when there is something unanticipated, then obviously our morale is likely to go down. We are likely to feel hopeless and helpless, and a lot of other psychological, emotional, cognitive, and behavioral reactions. So, instilling hope is also a cornerstone along with the listening or communicating process. Now, how do we go about it? There are certain components of psychological first aid. The first being protection from further harm. The second, opportunity to talk without any undue pressure on the individual. The third, that is the onus on the psychological first aider to be an active listener and actually understand what the individual in front of you or the group in front of you is trying to communicate to you. The next one is compassion and empathy. The next one being addressing and acknowledging the concerns. Subsequently, following up with discussing the coping strategies, providing adequate social support, offering to return to talk or reviewing periodically, and then referring to appropriate professionals if there is a requirement. See, psychological first aid is so important that in 2016, the World Health Organization, which is the apex body for looking after the health matters throughout the globe, they made it the theme of the Mental Health Day in the year 2016. So the UN, the United Nations, of which WHO is a sub-body, they take a lot of efforts in carrying out relief operations and carrying out work where there are individuals who are facing unnatural situations or calamities. And the WHO has set certain guidelines, and there are a lot of training modules as well available from the WHO, which guide us and which guide our efforts in providing effective psychological first aid. So the WHO defines what is psychological first aid and what psychological first aid is not. So what is it? It is the humane, supportive, and practical assistance to fellow human beings who have recently suffered a serious stressor, which may be in any form. If you take the example of the present pandemic situation, a lot of us are not able to carry on with our day-to-day lives. We are stuck in our homes and we are not able to go out for reasons of our own safety as well as the safety of others. So that may be a stressor for somebody. Or if you consider the recent floods in various parts of the country, the floods have had a serious impact on those who have been affected. Many of them have lost their homes. Many of them are not having access to even basic food and water. They are not having medicines and they have nowhere to go. So any serious stressor which an individual faces is likely to make them prone to lots of psychological reactions. So, psychological first aid intends to provide them support and assistance to overcome the situation that they are facing. So, it is a non intrusive, practical approach which offers care and support to those in need of it. It involves assessing the needs and concerns of the people who are facing the situation, helping people to address their basic needs such as food, water, and shelter. Listening, but not pressurizing the people to speak. It is not that it is just about listening, that the people speak to you and you are a passive listener. No. It is about listening, but equally about comforting people and helping them to feel calm, helping people connect to the available resources, the information, support, and services, and protecting them from further harm, both physically as well as psychologically. Now, what PFA is not? PFA is not something that only professionals can do. You need not, if you are trained in PFA, then you can very well administer PFA. And there are a lot of modules and lot of training programs which teach us how we can administer PFA. So it is not something that only a professional can address. However, you need to be trained to administer effective PFA. One more thing which I will add over here is many of us, without labeling it as PFA, we administer PFA. But if we are well trained or well oriented towards what PFA is, then our mode or a medium of administering the PFA is going to be more effective. It is not a substitute to professional services or professional counseling. It is not a clinical or a psychiatric intervention, although it is unconsciously and a hidden part of good clinical care. It is not psychological debriefing. It is not about asking people to repeat or analyze what happened or putting the time and events in order, like, chalo, you tell me what all happened to you and how did you face with it. It is not about that. It is not about pressuring people to tell you their story or asking details about how they feel or what happened. Again, the WHO has given certain guiding principles on what PFA should be like. So there are 4 key elements. The first being the preparatory phase, and then the active 3 elements being the triple L: look, listen, and link. So prepare is about learning about what the crisis event has been. If we do not know what the crisis has been and we just go to the spot of the crisis and start working, then we are obviously very ill prepared. So, in order to be well prepared, we need to learn about what the crisis event has been and how the people have been affected due to that particular crisis. The next is learning about the available services and supports, who are the governmental bodies and the non-governmental organizations which are available to provide services and support to the people in the affected area. And lastly, learning about safety and security concerns, both for ourselves and also to ensure that we do not cause any further harm to those who have already been affected. Now, once you go to the particular spot where your services are required and you start administering your PFA, then there are 3 components: look, listen, and link. So, what do you look out for? Observing for safety, observing for the obvious urgent basic needs, and observing for people with serious distress reactions. So you need to look with your eyes open, look carefully, and not just look, but rather observe with a keen eye on what are the basic needs. Only after fulfilling the basic needs, we move on to the next level in the hierarchy. This step is also important in order that we identify who requires our services first. If you take the example of a car accident, let's say, and there are a lot of casualties, each of them requiring first aid. But a good first aider will have to use his cognitive abilities and his judgment to find out who requires the services before. If there is only one first aider and there are a lot of casualties, we need to prioritize that who requires our services before. So, in a car accident, as we were seeing the example, a person who is profusely bleeding from the head is requiring or is a priority in comparison to a person who has just strained his ankle. So, this important component of look is essential to identify who requires our services first. We need to observe the people for serious distress reactions, which may be in the form of verbal or non-verbal behavior. To understand what the person is speaking, or to understand their verbal behavior, we need to have good listening skills. We need to make contact with the people who require support, ask them about what their needs and concerns are, and listen to the people to help them feel calm. If we go on talking and if we are not an empathetic listener, then obviously the motive or the primary aim of providing psychological first aid is not going to be fulfilled. So we need to be active listeners with empathy to ensure that we are utilizing our efforts in a proper way and channelizing them so that the ultimate aim or the ultimate goal of providing the PFA is achieved. The last step here is linking. We identified in the prepare phase, we identified what are the available services and the supports. So in the last stage, what we do is with the identified information which we have already collected, we help the people to address the basic needs and services by connecting them or linking them to the appropriate provider of those resources or services, and then help people cope with their problems, give them the right information. I stress on the fact right information because half knowledge is more dangerous than no knowledge at all. So, if we are going to give them information, it needs to be the right information which is available at that point of time. Considering the present COVID situation, It is a novel disease. That's why it's named the COVID-19, Novel Coronavirus Disease 2019. So there is a lot of research going on various aspects of the virus and various aspects of the disease, how it affects us, and the symptoms keep evolving from day to day. So we need to equip ourselves with the right information so that we pass on the right information and people are not harmed by accessing or by receiving the wrong information or false information. The next step is about connecting people with the loved ones and the appropriate social support. Loved ones will be their immediate family and people who are significant to them. And this is important because we are a first aider and we have not known the person for a long enough time that they may open up to us immediately. So, if we are in a position to connect the people with their loved ones, then they are likely to provide or they are likely to take over our role by providing the simple but important factor, which is support. Because we have better rapport or a better understanding with our loved ones, we are more likely to open up with them and share our deepest feelings and our deepest concerns with them. So we need to ensure that we connect the people with the right resources as well as providing them psychological and social support. So the COVID-19 stress continuum is as follows: ready, reacting, injured, and critical. So ready is, this is going to be hard, but we can do this. We are ready or we are equipped with the resources, be it resiliency or be it our own coping mechanisms, that we will be able to face and overcome the challenge of COVID-19 in an effective way. The next one is reacting. That is, the person is in an alarmed state, so much so that he is not injured, but at the same time, he is not ready. He feels there is a lack of communication, there may be changes in their personality, they may be experiencing fatigue and weariness, their productivity levels come down drastically, there may be sleep issues, they may not be able to complete their tasks because of poor concentration, poor attention, and various other factors. And the next stage is injured, where they are in a situation where they require help, they are scared, they do not have the motivation to do even their day-to-day tasks, they are exhausted, they have withdrawn themselves into a shell, there is emotional numbness, they depend on various substances like alcohol or other substances as a coping mechanism. Of course, their performance is also degraded, they have a pessimistic or a defeatist attitude, they are avoidant and they keep complaining, and they have this pessimistic thought that this is never going to end, this is going to be the end of the world, and a lot of other related negative thoughts. The next stage and the alarming stage is the critical stage, where they feel my life is over, I'm terrified, I'm feeling breathless, I'm not able to sleep, I'm having suicidal thoughts, I'm feeling depressed, there is a lot of damage to the relationships, they feel lost or out of control, they are unable to work, there is complete disengagement, there is paranoid feelings and subsequent isolation as well as panic. They keep hoarding and there are a lot of abnormal behaviors noted. There are feelings of scarcity, which in turn result in the hoarding behavior. They blame others, and there is blaming on irrelevant or biased blaming. There is panic reactions, and there are chances of self harm as well. So we need to ensure that people who are injured or critical definitely require professional help if they do not respond to the services of a psychological first aider. What do you see in this picture? You can comment in the chat box. It is the picture of a simple band-aid. Just as a band-aid is important for our wounds or if there is any physical injury, what I want to state over here is that psychological first aid is equally important and is no less than physical first aid. So We are providing physical first aid to people who are in need of that. At the same time, we need to ensure that they are okay. They are doing fine physically, but at the same time, they are doing fine mentally and emotionally as well. So, psychological first aid is as equally important as physical first aid. People who have experienced a disaster will show various reactions. We're going to cover them one by one. The first one being physical reactions. So, what are the physical reactions? They have somatic complaints or bodily complaints, as in they show physical or bodily concerns like difficulty in breathing, increased heart rate and blood pressure, profuse sweating, palpitations, that is, they can feel their own heartbeat. There is muscle tension and body pains, gastrointestinal or digestive symptoms, and other unexplained or explained somatic symptoms. They are in a state of hyperarousal, hypervigilance. They may be prone to experiencing headaches constantly. There is a change in their eating and sleep patterns, and they are drained of their energy. So they have changes in their eating habits where they may be eating excessively or they may be avoiding food altogether. There may be insomnia where they are not able to sleep or they are not able to regulate their sleep schedule and their sleep cycle, which will, of course, cause reduced energy and reduced performance during the daytime. The other reactions will be again classified into three as emotional, cognitive, and social reactions. So, the emotional reactions are those which are visible as emotional outlets or as manifestations of fear, anxiety, helplessness, hopelessness, feeling demotivated, not having the inner drive or the urge to do their day to day tasks, fearing the infection with respect to the COVID 19, guilt, anger, frustration, sadness, loneliness. So, if we look at the emotional reactions, helplessness, hopelessness, worthlessness, sadness, and loneliness. So, if these emotional reactions are going to be present for a prolonged period of time, then they are likely to cause further distress and there are going to be long term consequences. Coming to the cognitive reactions, there is impaired concentration, there is confusion or disorientation. There are a lot of intrusive thoughts which may not enable us to focus or which may disrupt our focus. Then there is dissociation of having the feeling of being disconnected from the world and others around us. There is the feeling of denial. There is hypervigilance and the memory is impaired. The social reactions will include reduced self esteem and reduced self confidence, withdrawal, irritability, interpersonal conflicts between family members, conflicts with friends, conflicts with those in our social circle, avoidance of people, avoiding our own family members, avoiding people in our social circle, avoiding even talking to friends over the telephone, lack of self care due to a lack of motivation, which we saw in the emotional reactions, compounded by the cognitive reaction of poor concentration, poor memory, etc., and obsessive thoughts and compulsive behaviors, especially if you consider about the hygiene factors in the context of the present pandemic. There are people and there are cases, I should not label them as cases, but rather as people who keep washing their hands so much so that it has disrupted and almost resulted in forms of obsessive compulsive behavior requiring professional help. The psychiatrists have reported that there is an increase in the number of people reporting with obsessive compulsive thoughts and behaviors, especially relating to the washing time, because of the behaviors or because of the norms that we need to follow right now. There are consequences which will be disruptive and which will have consequences, so we need to be able to address them at the right time so that these do not have long term implications. The long-term implications will result in anxiety, depression, substance use disorders, adjustment disorders, PTSD or post-traumatic stress disorder, and worsening of existing mental disorders if there are any. So if you look at the long-term effects, they are all manifestations of the various reactions we saw. We'll take the example of depression. Depression is primarily characterized, if you tell this to a layperson, it is primarily characterized by three factors: helplessness, hopelessness, and worthlessness. And we saw in our previous slides that these are all reactions to various stressors or the situation which the individual is facing. So if the person is unaddressed, or if the person does not get the help that he or she requires, then he is likely to fall into any of these long term effects, which are, of course, going to be detrimental both to his mental and physical health, consequently affecting his daily life in all aspects. So, coming to the question, who can benefit from psychological first aid? I have put the answer here. Anyone can benefit from a psychological first aid approach. As we already saw, it is not specialist care. Anybody who is trained in psychological first aid can administer psychological first aid. So people should be reported to further support if it is required. Example, if we see that people are in need of immediate medical care or life-saving services, then we should refer them to the appropriate professional practitioners. If the people are so distressed that they are incapable of taking care of themselves or of their responsibilities like their children or the elderly people in their house, or if the individual is likely to hurt himself or others, then they should be reported or referred to the appropriate professional practitioners. Now, some people, they do not want help and their wishes should be respected. One more thing, or an important factor to be remembered in psychological first aid, is we need to respect and treat everybody with dignity. Nobody is above or below the other person. No matter what their social status is, what their gender is, what their ethnicity is, we need to treat everybody with compassion and respect. So if they say that I do not want to talk to you right now, then find out through their body language and their non-verbal communication on what might be a factor that they are hesitant to communicate with you. So if there is a factor that they do not want to talk to you, you should respect that and okay, get back to them later when they are in a safe space and when they feel that okay, I will be able to communicate with you, I will be able to open up to you. If somebody is behaving in a way that puts them in a vulnerable place, then we need to safeguard them, or we need to talk with the appropriate supervisors or the appropriate professionals on what can be done to help them so that they do not fall a victim to the long-term consequences. As I said already, we need to identify and prioritize those in need of PFA. So how do we identify them? We identify the people who appear to be distressed. This is again by the principles of looking and listening. So we need to keep our eyes and ears open and identify people who appear distressed, people who are actively seeking support for their psychosocial needs, people seeking support for other needs. They may be physically injured or they may be experiencing physical symptoms, but we need to ensure that they are okay mentally and they are okay psychologically. People who we are in touch with and who have been identified vulnerable to the psychosocial impacts of a particular disaster or of a particular situation need to be kept in mind very specially. So here I will talk about the vulnerable populations, who are the children, the elderly, and the people who are already experiencing some or the other mental disturbance or mental disorder. They are more likely to suffer the impact of a situation which is likely to cause them any of the reactions, such as the psychological, cognitive, or the behavioral reactions. So we need to prioritize these vulnerable populations before we can start helping those who can be prioritized at a later stage. So how are children affected? Children they are not equipped with all the facts that are surrounding a particular situation. A child may be experiencing such a situation for the first time. During a pandemic, they may be seeing this, they have never seen this in their life, they have never seen such an abnormal situation in their life, and this is a new thing for them. So they do not know how to cope with it and how to react to it. They may be directly or indirectly affected. If you look at the pandemic situation, let's say the parents of a child are affected and they need to be hospitalized. So, what is the child to do? The child is not infected and the child can stay home. But how can the child stay home alone? So, they are indirectly affected by the consequence of the situation. And because of this direct or indirect effect, there is a disruption in their normal day to day routine and potentially a loss of a loved one. They may be kept separated from their parents or from other loved ones for a prolonged period of time, or they may have bereavement also, wherein they lose somebody who is very dear to them, like a grandparent or a dear friend. So we need to address these populations by identifying and mitigating the risk that they are likely to face. Children generally they are resilient and they can cope because they are easily moldable and they are flexible. They have more flexibility as compared to adults. However, their reactions will be based on their age, their developmental level, the proximity to the event. How close are they to the event, or how close are they to the situation? If it is somebody in their family who is experiencing a distress situation, then obviously they are in very close proximity to that particular event. But in the general broad context, if you consider right now, they are a part of the society which is undergoing a crisis. So we need to understand and estimate what is the proximity of the event to the child. Their exposure to the event has an impact on the family members and how the family members are reacting to that situation. The personal, family, and material losses as a consequence of the disaster, and the response of the family and the community as a whole. So, children will be resilient, however, their reaction will depend on these factors, and we need to keep in mind these factors while working with children so that we can address their needs in a better informed way. So, in order to be a good PFA practitioner, there are certain skills which we can develop by means of either learning or by means of practice or by having a practical exposure in administering psychological first aid. However, we need to ensure that we take steps to develop these skills and competencies so that we can help the people whom we are helping in an effective and better way. So, being a good listener is the foremost and the most important part of PFA for identifying what help and support each individual requires. We need to be well informed so that we can give the accurate information and also gain the trust of the people with whom we are working and with whom we are communicating. Have the ability to encourage active coping mechanisms. For example, helping people make decisions about the steps or planning for the future and how they are likely to overcome the present situation. Encouraging and helping people to connect with their loved ones in community centers and in spiritual supports. Being aware of the different cultural preferences and needs, adopting a non judgmental and empathetic approach, and not to forget, knowing how to look after our own well being and accessing the right support which we require. See, if you consider a jar of water, it is filled with water. Only when a jar of water is filled with water will the jar be able to pour water into all the glasses which are there. So only if we have the energy and only if we are well and our well-being is not compromised, we will be able to fill the glasses of others. We should consider ourselves as the resource or the jug, and those who are receiving our services are the glasses. So in order to fill the glasses of others, the jug needs to be full. So if you agree with me on this point, you can put in your replies in the chat box. And if there are certain differences or if there are other viewpoints, kindly share that too. Now, considering the present situation wherein there is a lot of emphasis on social distancing, mind the fact it is just social distancing and not emotional distancing. The concept of telemedicine, telehealth, telerehab, all of that has come in wherein we are dependent or we are rather utilizing technology for our benefit. So similarly, we have tele-PFA as well. It is being implemented in other countries as well as in India, wherein there are a lot of NGOs who have 24-hour helplines where they take calls from people across the country at any point of the time and help them cope with the situation that they are facing. So tele-PFA has certain guiding principles. Firstly, we need to ensure that we have sufficient time in case there is a technical difficulty. We need to have the appropriate equipment or we need to be equipped with the right technical support also. Next, we need to make sure and we need to be clear on how long a call is expected to be taking. If you're going to be in a hurry while we are talking with a client over the phone call or through a teleconference, then we need to have the time and we need to have a clear idea of what is the expected duration of the call or the conference. Next, we need to speak slowly, clearly, calmly, communicate empathy and warmth without using a lot of technical terms and also ensuring that the message is delivered. If you are going to talk to a person who understands only, let's say, Marathi, and you are not competent enough to talk in Marathi, but you are only knowing Hindi and English, then obviously that person will not be able to communicate effectively with you, and you will also be not able to solve their queries. So, language is a barrier which needs to be identified, and we need to make sure that we connect the right person with the right first aider or the psychological first aider. So we need to understand what are the expectations of the client and communicate in a way which the client is able to clearly understand. When possible, the caller should have their own private space to complete the call so that we maintain the privacy and we do not leak out the information which is being given to us with a lot of trust. So, if possible, we need to have a private space where we will be able to complete the call without the possibility of being overheard or without the possibility of interruptions or disruptions. We also need to aware of our own limits. Like I mentioned previously about the language, we need to be aware of what our limitations are. If we are not able to work and establish a rapport with, let's say, children, working with children requires a different type of approach from working with the elderly. So we need to be aware of our own limitations and also know how to refer a difficult call or how to refer a particular individual to the concerned professional. Coming to the skills and how do we go about this process, effective communication and learning how to listen is an important part of learning to be a good psychological first aider. So, listening is about understanding and being able to listen to communicate better. It helps to begin the conversation, it helps to pay attention and listen actively, accept the feelings of the person on the other end, calming the distressed, asking about their needs and concerns, and helping those in distress find solution for their needs and problems, and also for opening and closing the conversation. How we will communicate with them or how we talk to them has a significant and a deep impact on how the person is likely to react. So, opening and closing a communication will happen effectively only when we have listened actively and we have comprehended what the other person is trying to convey. So, if we are able to establish a good rapport and if we want to establish a working relationship, we need to be good, empathetic listeners. What are the steps in this? We introduce ourselves, how well we are equipped, and what is our role, so that there is no false information, and also to avoid certain misunderstandings. The person may be thinking that, okay, you are somebody who is a medical doctor, and they may start discussing about their respiratory problems with you, or they may start discussing their physical ailments with you. So, introduce yourself first and what is your role. check that the person you are helping or you are communicating with is happy to talk and is able to talk. That is, they have the time to talk to you. Otherwise, if it is going to be a hurried process, then the entire exercise itself is meaningless. If they are in a position to talk to you, only then will you be able to listen to what they say and offer appropriate support. Then establish expectations around confidentiality and the length of the interaction. A review may be suggested after the initial conversation. We need to be aware of our own limitations and use creative approaches. Agree on the duration of the call or the visit. At the end of the contact, agree on an action plan and follow up if it is necessary. So during the process of active listening, it is an approach and it is about conveying empathy to calm the individual, help them feel understood, and allowing them to express their emotions honestly so that we find out about their needs and assist them appropriately. So, if we are doing this in a face to face manner, then we use both the strategies of look as well as listen. However, if it is going to be a tele PFA, then we have to rely primarily on the listening process. So, if we are doing this in a face to face manner, we will be able to judge or we will be able to find out from their body language, from their eye contact, from the way that they are positioning themselves, and a lot of other factors on what they are going through. So, to pay attention to the tone of voice, paying attention to the body language, and understanding what they are trying to convey. Listening carefully to what people say and clarify your understanding by repeating back, summarizing, and reflecting back on what they are trying to communicate. So, how do you make the person understand that you have understood what they are trying to say? If you're talking to somebody and if you want to make them understand that, okay, I follow what you're saying, how do we do that? We repeat back certain phrases what they have said. It's not about repeating the whole sentence or the whole thing which they have said as it is. Rather, it is about summarizing or taking the key elements of what they have said and reflecting back on how we have communicated. The step of reflecting is equally essential because in order to develop the competency to be an effective PFA provider, we need to constantly improve ourselves and get better at our technique. So, we need to analyze within ourselves on what the person is trying to communicate. And if we are going to do that, then what we are going to speak back or whatever support or advice we are going to offer to them is going to be more rational and more well thought. We need to demonstrate that we are listening by using nods, murmurs, or encouragers. Okay, I understand what you're trying to say. By using facial gestures like, yeah, I'm able to follow what you're saying. Using language that is simple and easy to understand. And developing and exercising patience if the people are confused or if they are finding it difficult to talk to you or explain to you what they are facing. And also to ensure that we tell them it's okay if you're not comfortable talking to me right now. I'm there for you. The next time when you feel like talking to me, I will be available and you can contact me or an alternate service provider. So there are certain key phrases which we can use to convey our interest and empathy, which can be like, I understand what your concerns are. And a lot of people do think about the situation in a similar manner. It is natural to feel sad, angry, upset due to the current situation. I hear what you're saying, or I'm listening to what you're saying about the difficulties that you're facing. In this situation, anybody would react to it in a similar way, and your reaction is quite normal and it is not something to be alarmed about. Maybe we can discuss the possible solutions if you're interested. What services or what we can offer is whatever we are willing to offer or whatever professional services that we are equipped and engaged in offering. I am concerned about you and would suggest to refer to somebody who will be able to help you in a better way. So these phrases will convey our interest and empathy. Only when our interest and empathy is conveyed to them, they will feel that, okay, they are in a safe space, they are discussing their problems or they are discussing what they are going through with a person who is trained and with a person going to be able to help them to cope with the situation. So these phrases, it may be in English or in the language in which we are communicating with the individual, will help us to convey our interest, establish a rapport, and ensure that the services are reaching the person and that they are benefiting from what we are doing for them. See, we are utilizing our time for somebody. At the same time, they are utilizing their time to seek help from us. So we need to respect the time that both of us are utilizing and make sure that what we are doing is not just a sham, but rather something which is effective and which is going to be helpful for the people. Dealing with distress will involve exploring the concerns, normalizing and naming the reactions, using appropriate calming techniques, and exploring the coping mechanisms. So, we will deal with each of it one by one, explore what are the concerns that the person is facing. This is about finding out what is particularly distressing them or what they are particularly worried about. It may be that the person is worried about their basic needs, on how they will procure food when the whole country is in a shutdown. How are they going to procure food for themselves and for their families? Or somebody else might be feeling emotionally distressed. So we need to identify by exploring what is important and what they are actually concerned about. We tell them something like, tell me a bit about what actually worries you. And if they are opening to us, to maintain the flow of conversation, we use phrases like, is there any other factor or anything else that is worrying you and that you would like to discuss about? I sense that there is something more on your mind, and if you don't mind, can you open up about it? So this is how we explore the concerns that the individual is facing. The next is about normalizing and naming the reactions. We already saw the different types of reactions, the cognitive, the psychological, the behavioral reactions. So, how do we normalize and name the reactions? We assure them primarily that it is a challenging situation and it is quite normal to react and to be worried. Anybody in such a situation would do so. However, we need not tell them stories about how people have gone through such a similar thing, because that will be an invasion of privacy. Rather, our focus should be on building empathy. That okay, many people go through such a similar situation, and it is normal to seek help for what you're going through. I wonder if it is of any help to you to know that the feelings are natural for many people in the present situation. So the feelings can be overwhelming, and it will be helpful if you can talk about what you're feeling so that we can manage together by using an approach, a team approach, to manage the feelings or manage the emotions that you're facing. The first step here will be acknowledging the feelings. If we are going to deny what we are going through, then we will not be able to face what we are going through, right? So we need to acknowledge how we feel and communicate that so that we can benefit from the help that is being offered. Check what the person may be scared of and reframe them with the message of hope. So, installation of hope, as we saw in the previous slides, is an important factor in PFA. We need to tell them something like, you tell me what your fears are. Many people and many parents are struggling with the workload and the duties which are a consequence of the current situation. You have managed to look after your family in a capable way, and we are there to support you and help you if there is support or help required. There is a lot of community support available as well as professional services available to help and to ensure that you are able to do the right things in the right way. So we instill the hope in them or give them the confidence that they are not facing this situation alone. Rather, we are with them in facing this situation, and we will be able to help them in cope with this situation. We use calming techniques and coping mechanisms. The calming techniques will involve grounding, breathing and relaxation techniques, and cardiovascular exercises. So, grounding is a technique in which it is literally about placing our feet solidly on the ground and sensing the support that the ground or the floor has to offer. So this can be used, this grounding technique can be used no matter what the situation is, be it anxiety or be it the feeling of restlessness. It is a very effective and proven calming technique. They need to sit in a chair, place their feet firmly on the floor, and tense the leg muscles by stemming the foot against the floor. As in, they have to press their feet as if they are trying to get up from the chair without actually getting up from the chair. The next is breathing and relaxation techniques. Suggest that they begin by noticing their breathing pattern. So nowadays we have a lot of emphasis on the concept of mindfulness. Mindfulness also suggests that we need to be focusing on our breath. So we need to observe how we are inhaling and exhaling as each breath passes by, feeling it in the nose or in the mouth on the way, and sensing how it fills our lungs, expands the belly and the sides of the chest and the lower back. Not to forget cardiovascular exercises or aerobic exercises. These are proven to help us in various ways, be it their physical benefits or be it their benefits for mental health. So cardiovascular exercises is important but often overlooked. So we need to emphasize on that and help people to ensure that they get regular cardiovascular exercise, be it in the form of walking within the house at the present situation or outside their house if the situation allows it. This will help them to calm their mind, and also it will act as a distraction from the situation that they are facing. And this should be avoided during the later part of the day because it impacts our sleep. So any sort of rigorous physical activity or exercise needs to be scheduled so that it does not disrupt with our sleep and eating habits. The next is exploring the proper coping mechanisms. So we have a lot of positive and negative coping mechanisms. We need to explore what are the available coping mechanisms and what are the coping mechanisms that we have been previously using. So if we are in the tendency of using a lot of negative coping mechanisms, then how should we eventually break free of them? And also exploring the positive coping mechanisms and implementing them so that we can cope in a better way. And each person is an expert on how they can cope best. It is about each person. What may work for me may not work for you, and likewise. So ask the person what they normally do to calm themselves down and make themselves feel better, and see if they might be able to use that technique in the present situation. Considering the chaos of the situation of a disaster or of an unnatural event, what we see is people often tend to forget or often tend to not follow what they have previously been doing. So we need to remind them, okay, you have been doing all of these previously. So it would be helpful if you could recollect what you're doing and also try out whether your previous technique works in the current situation. It is always easy to do or implement something which we already know in comparison to using a new technique. So that is the reason we emphasize on a person using an already existing positive coping mechanism before trying out a new mechanism. So if they do not have something that they normally use, we can suggest activities which will help them relax or focus, like connecting with others, talking about what is worrying them, using physical activities as an outlet for their emotional reactions, keeping the mind active by doing puzzles, quizzes, sudoku, something which interests them, like their hobbies of reading books, listening to music, doing craft activities, getting outside the house, doing gardening, things like that, which interest them and which help them calm and distract from the situation which is hampering their performance and which is impacting them in a negative way. Avoid the use of behaviors such as substance abuse. Now, because of the present situation in general, also, I will say that people tend to fall back on the substance addictions if they were previously having any, or if they tend to develop substance addictions also. Alcohol is used as a common coping mechanism, a negative coping mechanism at that, and this obviously impacts their health in a negative way. So we need to discourage such behaviors. it will give them temporary relief. They feel that, okay, if I consume alcohol, I'm able to forget my worries, I'm able to sleep better. But in the long term, what is that alcohol going to do? It is going to be detrimental both to their cognitive functions as well as to their overall physical health. So avoid encouraging such behaviors which can, form a dependence as a long term consequence, and obviously it is a negative coping mechanism. So avoid such things and ask them to explore and implement positive coping mechanisms. So coming to the do's and don'ts, learning the appropriate facts, following the directions as per the guidelines of the government or other appropriate authorities, listening to people and trying to reduce their distress, highlighting positive behavior, helping them to understand their own positive behavior as well as the positive behavior of others and adapting that. Adapt the care you give to the needs of each person. This is about using an empathetic and a personalized approach, being aware of the cultural differences. For example, about the physical contact. Right now, we are not able to, we are discouraged from using physical contact. And even if you see culturally, between the same genders, it is okay to touch people. A female touching a female is considered okay in our Indian culture, but not the other way around. So we need to be aware of these cultural differences and we need to be sensitive about these differences. Coming to the don'ts, we do not ask the people to describe their experiences in detail unless they want to do so. So if they want to talk about it in a detailed way, then it's okay. We completely ask them to go ahead with it. But we should not force them to describe the situation that they have faced or ask them to put a chronology of time of events and the order of events in which they took place. So there is a risk that telling you about the difficult experiences at the time of the event may trigger what they went through. We see this commonly for people who are more prone to PTSD, that is post traumatic stress disorder. When they recollect the experience which they have lived through or the lived experience, then there is a greater risk that even at the present moment, they will experience the consequences that they experienced previously, or even worse. There may be emotional outbursts, there may be crying spells, etc. So do not force people to talk to you about anything. Let them be comfortable and ensure that you are a good listener. Do not make assumptions about people experiences based on your past experiences, like, okay, I have worked in this situation previously and this is how people reacted. So that is not how everybody will react. Each person has a different way of reacting and each person reacts in a way which is unique to them. So don't make assumptions on how this person will react. Don't assume that each person will be having the same kind of distress. Don't assume that everybody will be severely upset. Don't talk about the symptoms or disorders by using a lot of technical jargons. Don't try to provide support beyond your capabilities. So if you are not equipped with the right resources and the right skills, in the best interest of the client or of the person to whom you are providing services, it would be better if you refer them to the person who is properly trained in doing whatever essential help is required for them. So what are the good communication things which we need to say and which we need to do? Finding a quiet place to talk, minimizing the outside distractions, staying near the person but keeping an appropriate distance. This is again with relevance to the cultural factors. Letting them know that we are there for them and we are listening to what they're talking. Being patient and calm. Providing honest, factual information. If you don't know something, it is okay, or rather, it is more acceptable for accepting that, okay, I don't know this, maybe I will look up or I will guide you to the right resources. There is no shame in denying something which we do not know, because if we are going to deny and provide the wrong information, then that will have far worse consequences. Giving the information in a way which the person will be able to understand by keeping it simple, short and crisp. Acknowledging how they are feeling and any loss or important event that they share with you, you need to be there for them and empathize with them. This is not about sympathy, like saying, oh, I'm so sorry for what happened to you. It's about, okay, I understand what you've gone through it and I am sorry for that. Respecting their privacy and confidentiality and acknowledging identifying their strengths and encouraging them to use their strength to build resiliency and cope with the present situation. Coming to the don'ts, do not pressurize them to tell something. Do not interrupt unnecessarily or tell them to rush up, get on fast, I do not have the time. Do not give your opinions or judgment. So, this is non biased and empathetic listening. Not touching them if it is inappropriate. Do not judge them, like saying, oh, this is not how you're supposed to feel. This is not how everybody else is reacting to it. Toughen up. This is not how you're supposed to behave. Don't say such things at all, because that is likely to shatter their self esteem in a far worse way. Not making up things you don't know. Not using a lot of technical terms. Not telling them others' stories. And not talking about our own problems. Not giving them false reassurances or false promises. And don't feel that you are the only person who is supposed to solve all their problems. Rather, if they want help from somebody else, it is okay. It is not your personal loss that they say, I'm not comfortable with you, I would like to seek help from somebody else. It is okay. Each person can develop a trust and a rapport with whom they are comfortable with. So it's not a personal loss if an individual is not able to communicate with you. And don't take away the person's strength and sense of being to be able to care for themselves. That is, do not judge them in a negative way, and do not put them down in front of anybody, and do not give them any sort of wrong advice or something which you do not know. So, summarizing it all, dignity in mental health is the need of the hour. The WHO took it up in 2016 as well. For the whole year, they worked relentlessly for that. PFA is for everybody. It can be provided by people who are trained to provide it. Everybody should have access to PFA following a crisis event and as a part of the spectrum of mental health and psychosocial support services. It is widely used by various bodies of the UN, by various NGOs, etc., for disaster preparedness and response. So that was all about PFA, and that summarizes my views. If there are further views and queries, we can very well proceed with that. Thank you for being a nice audience and listening to what I had to offer.
Yes, ma'am. Thank you so much, ma'am, and for summarizing it so clearly, so preciously. Thank you so much, ma'am, for that. Definitely, I want the participants, if you have some views or some doubt, then please do comment in the comment box so that we can ask all these things to the ma'am.
There's one question from Suryakant sir. May I
Yeah, Shivalika,
forward?
you can take the question if there is any question.
Yeah. The question is that, ma'am, what is psychogenic dyspnea? A 9-year girl having shortness of breath without any psychological reason. What what measures her mother can take as psychological first aid and self care? And the parents are not living together.
The parents are not living together, as in the child and the parent are separated, or the parents do not cohabitate. How does that explain it?
Ma'am, the girl is living with
Okay.
her mother.
So, psychogenic dyspnea or psychological dyspnea is about shortness of breath, and it is a common symptom seen in anxiety. So, without any physiological reasons, we saw that it is without any physiological reasons. That may be because of the psychological manifestations, and Sir has already mentioned that it is of psychogenic origin. So the mother can take measures to identify what is the cause of anxiety. Is it the separation of the parents which is causing anxiety to the child, or is it some other factor? Is it something in the school, or is it bullying by the friends that because of the present family situation, the society is bullying the child? So identify what is the cause of the psychogenic dyspnea and teach coping mechanisms to overcome the particular difficulty that she's facing. Psychogenic dyspnea, we also need to ensure that if there is a lot of physiological distress, so much so that the child often has dropping SpO2 levels and respiratory distress, then medical intervention can be required, and it is essential that they reach the proper medical service provider.
Okay, thank you so much, ma'am, for answering this question. But, ma'am, I think your camera gets off. You are not visible to us.
Just a minute, give me a minute, I'll check
Not
that.
visible.
Yeah, sure, ma'am. Okay, so I think that Suryakant Malhotra sir get their answer, and the next question of the Suryakant Malhotra sir we will ask to the ma'am. And till the time we want all the participants, please do ask your queries, post them in the comment box. Yeah.
Yeah, ma'am. The another question is that, ma'am, where one can have training to become
In
PSA?
order to be a psychological first aider, right now, considering the pandemic situation, there are a lot of courses being offered online also. So we need to identify which suits our requirement, and we can enroll ourselves in the online course and get the appropriate certification. Other than that, the UN keeps doing a lot of training throughout the world in different centers in collaboration with a lot of NGOs. So whichever resource is accessible to us, by means of finding out, okay, in our city this training is taking place, so we can attend that training program. The UN training program is very comprehensive and standardized throughout the world.
Okay, thank you, ma'am. There's no more questions, I think.
Yes, ma'am. Yeah, there is no other question. Thank you so much, ma'am, for this session. And thank you so much for all the participants for being with us. If you have any query, then you can post in the comment box. Otherwise, you can just message on our WhatsApp number as well. We will forward your query to the ma'am. And I hope that all the participants benefited from this program, and they will know a little about what exactly PFA is and how it helps an individual, because I know that most of the participants previously do not know about it, like what exactly PFA is. They must have heard about it, but they do not have so much knowledge about it. So I hope that it will be helpful for everyone.
Ma'am, there are questions from our
Please go
audience
ahead.
now. The first question is from Natalie, ma'am. That, good afternoon, ma'am. Please guide me on OCD as I am facing the
Okay,
problem.
so OCD is obsessive compulsive disorder, wherein the thoughts or the obsession and the behavior which manifests as a result of the obsessive thoughts is the compulsive behavior. So here we need to exactly address what kind of OCD it is. Currently, as I already mentioned, it is about the hand washing OCD. So we can set up a schedule here. Scheduling works as a very effective mechanism for OCD, wherein we set up a schedule or particular trigger events based on which we will indulge in that behavior. I will take the example of hand washing itself. So the moment we step into our house after going out, we need to wash our hands. Or if we are going to have some meals, we need to wash our hands before that. So every time there are certain activity triggers that we will need to particularly do the hand washing ritual before that. So based on those triggers only we will be doing the action of hand washing. Other than that, at any situation, we are not supposed to do it unless it is essential. Rather use an alternative of using a hand sanitizer if you're so concerned. Gradually step down the use of hand sanitizer also, because otherwise that can also lead to an obsession for using the hand sanitizer. So by using a schedule or by using activity triggers, we can try to avoid the particular compulsive behavior in which we are indulging. I hope that answers that.
Thank you, ma'am. And the Methli ma'am said, yeah, Methli ma'am said the OCD is of hand washing. She replied. So the next question is from Suryakant Malhotra sir. That, ma'am, what coping mechanism can be taken to make the child feel secure, calming the
Calming the
anxious
anxious
child?
child is, I think this is the same child in question who had psychogenic dyspnea, if I'm not wrong. So after identifying what was the cause of the particular reaction which was being exhibited, the coping mechanisms we saw about the technique of using grounding and about the practice of mindful meditation or breathing exercises. So we can teach that to this particular child. Also, we need to work on the self-esteem of the child to ensure that she does not fall prey to the external stressors or the external factors. So encourage the child to do activities which she is good at, which may be something like art and craft, or which may be in relation to their academic subjects also. So that will boost their self-esteem and gain confidence, and thus reduce their anxiety to an extent.
Okay, thank you, ma'am. I think sir get the answer, and sir replied that the child is
Sorry,
that same girl.
the child is the same girl. Okay.
Yeah.
Okay.
Yeah. Okay. Thanks a lot, ma'am. Thank you so much for this
Thank you.
informative
Thank you
webinar,
for
ma'am.
having me, and thank you for
Yeah.
being wonderful
Sure.
hosts, Ms. Shivalika and Garima ma'am, both of you.
Yes, ma'am. Thank you so much, ma'am,
There's
for choosing psychology again, for sharing your valuable knowledge with us. And I
Thank
would
you.
like to
Thank you.
thank all the participants for being with us.
yeah.
Thank you, ma'am.